have our diagnosis.
I'm afraid to ask, and I'll be scared to death of getting a heart attack or something.
We do have, are you recording me?
Yeah.
Alright, so here's a picture. And this represents the opening of the voice box. And this is the top, this is the bottom, and this is the right side, and this is the left side. So my two-cup hand represents the laryngeal opening.
Mm-hmm.
And this is the bottom, this is the top. This is the right side and the left side. Sitting in the voice box, recessed within the voice box itself, are the two tissues that vibrate to create the bark. So if my little baby fingers back here...
She was squawking back there, I heard her. So.
Huh?
Mine was squealing back there, I heard her.
Okay. So if this is the vocal cords that create a bark, what normally should happen is the voice box should dilate open on inspiration and then go back to a neutral position on expiration. Inhalation, exhalation. Now at rest, what normally should happen is the voice box stays in a fixed position, air flows passively in and out.
Okay.
And for some reason, when she's resting or sleeping, she makes that inspiratory kind of noise, and it's probably the vocal cords that are collapsing towards the midline. Because when we looked at her during the scope procedure, they were both, when she breathed in, they were both collapsing into each other. So they were basically causing a partial obstruction. Now keep in mind, they should dilate this way, and the arytenoid should open up this way to help open up the lumen. And she may have the ability to still do her agility because the only thing that's working in her is this right arytenoid. The right side is still able to open up a little bit on inspiration. So she breathes in hard and the left side collapses, the right side opens. But both vocal cords are collapsing towards the midline. So when she breathes hard, she's breathing through an opening here at rest, and maybe when she's pulling it open during agility, it opens it up. She has probably about a 40% airway right now, 40%.
Out of 100?
Mm-hmm. So it's enough to get her by. And with the cooler months, they tend to breathe a little easier because it's more easier to breathe when it's cooler. But we know that laryngeal paralysis is a progressive disease. We know that it's a neurologic condition where the nerves that are responsible for opening things up to breathe loses that ability to stimulate the voice box, and things start to collapse more and more. Eventually, this right side won't be able to pull open, it'll start to collapse, and when you see that, she's going to sound more and more like she's having an asthmatic attack. Okay. Now the reason why she's coughing and gagging is that she's got laryngitis. As these structures start to collapse, okay, the inflammation in that area causes her to want to cough and gag. The reason why her voice box and her voice is weaker is that the vocal cords are also paralyzed. They're getting weaker and weaker and weaker, so her bark gets more muffled sounding. So this all fits. So we have a diagnosis on scope of laryngeal paralysis.
That's the worst prognosis, though.
Left side is totally paralyzed, and the right side is weak. Okay. So again, she's not in a crisis mode, but once the right side starts to give in, then she'll collapse. She'll have a hard time breathing, she'll collapse. Okay. There is a surgical correction for this where we open up the lumen of the voice box by removing the vocal cords, and we tack open the voice box. This is a procedure we do here to help.
Is this that special one you... Okay. But what happens to her voice?
She loses her bark. She tries to bark, but she's going to be blowing air. Yeah. Because if we leave those in there, they're still going to compromise her airway because they're just basically collapsing and blocking her. Yeah, this is a bilateral, this is the procedure we do here, bilateral vocal fold excision. This opens up the inside of the voice box, and then we also do a bilateral arytenoid pexing. This is where we tack the arytenoid cartilage to the thyroid cartilage. And that combined procedure provides a more functional airway. Not 100%, there's no procedure that can make it 100%. We can't make the nerves come back. We did sample her lower airway. I didn't see anything significant. You know, the cytology, the wash,
Yeah.
and the culture. The estimate did not include this because I didn't think we were gonna head in that direction. I thought it was gonna be laryngeal paralysis, just on my physical exam.
Yeah, that's what it is, right?
And that's what your history shows, and my scope confirmed it.
Mhm.
Yeah. She doesn't need surgery right away. In fact, she may just kind of be like this for the next 2-3 months. She could slowly get worse, but I tell you, when spring, summer comes and it starts to get warmer,
Mhm.
she's gonna have a harder time. And then at that point, you need to reconsider the surgical procedure. There's no drug I can give her to make her breathe better. This is not something we usually manage medically. It's something we manage surgically to correct the airway. There can be complications with the surgery, with any surgery. The main complication is aspiration pneumonia.
Mhm.
Whenever you do surgery on the opening of the voice box and you distort it, it puts them at risk of aspirating. But the incidence for aspiration on our procedure is lower than that of a tieback. A tieback is where you go in and suture one side open,
Yeah.
like this. The only problem is if you tie it back and they go to swallow, if that allows food to leak past, because you pulled it out in a manner that allows food or water to leak past, that stuff will go down into the lungs, and that's how they get pneumonia. So that's it in a nutshell.
Mhm.
If you want, I could still submit the cytology, the wash.
Mhm.
It probably will show some mild inflammation. The culture probably won't be significant, but it will be extra on top of the estimate I gave you.
Oh, if you do that.
Yeah. But we have our diagnosis based on the scope. I didn't see any evidence on x-ray of having
Yeah.
significant bronchial disease, pulmonary
So what does
disease.
this mean for my plan with her? I guess it's just a matter of time then.
Yeah, matter of time, yeah. Be careful with agility. I mean, if she's still able to go through it, but there will be a point in time where you'll start to say, whoa, she's slowing down, because the opening will get less and less and less.
Yeah.
Yeah.
So, like, time, you think, how long do you think she would have if I don't do anything?
You probably might be able to get her through this winter. You know, coughing, gagging, breathing a little heavy at night. And then come spring, summer, she's gonna get into trouble. As soon as you start to see her just huffing and puffing coming out from going to the bathroom, you gotta give me a call. Or, even if it's cool, over the next
If I
couple,
notice
3
a
months,
difference.
if you see her starting to, she's coughing and gagging more, she's making this noise,
Yeah.
just not at sleep, but on a regular basis, then you need to think about the surgery.
Okay, and what does this procedure cost?
Surgical procedure costs about $4,000. Yeah.
And there's still no guarantee how long she'll live after that?
If, let's say she gets through surgery, and we create an airway that's 80-85% functional, better than what she has now, she doesn't get aspiration pneumonia, she continues. If she's gonna get it, usually it's within 2 to 3 days after surgery. Once you get her past that, the chances are very... Does she swim?
No.
Okay, yeah. So yeah, once you get her past and the sutures come out, then I may not see you back. And she's what, 10 and a half, you said?
Yeah.
Yeah. So they can live a normal lifespan.
Yeah. Well, her normal lifespan is 12 to 14 years.
I don't know, that's pretty conservative. I've seen female springers live.
Up to 16.
Yeah. So 12 to 16, average it out 14 years.
Yeah, so this might give me another 2 or 3 years with her.
Yeah, that'd be nice.
Yeah. Wow, it's just the worst scenario though. Like,
Well, it could be worse. It could be a tumor, you know.
oh yeah. This is just her, she's just, is it biological, or you said that?
Well, we know that certain breeds, we tend to see it on a regular basis. The labs, the golden retrievers, but they believe that they're congenitally predisposed. They can get other neuropathies, meaning weakness of the hind legs, dysfunction to the esophagus, but I saw no evidence of any megaesophagus on radiographs. That could be a paralysis of the esophagus. I didn't see any evidence of that on x-rays.
So there's no cancers or anything like that?
Not that I could pick up, no. And also, I have seen them in the Britneys. In fact, I did one last week.
Brittany?
Yeah.
And did
Yeah.
they do
No,
anything?
that was a different spaniel. It was a bigger
English Spaniel?
English spaniel. It was an English spaniel. Yeah.
And did they get past the first couple days?
Oh yeah, homed and
was that?
That one's probably like 12.
Oh, so it's a lot
Yeah.
older than Mandy.
Yeah. Somewhere in that same range. I could look it up exactly, but they're always 9 to 14 years of age, somewhere in that zone.
Oh, when this
Comes on, yeah.
Now, what activities can I do with her after she recovers, if she does recover from something like this?
Pretty normal, yeah. You know, she won't have 100% airway, but if she's getting to agility
At
with
40
this, and 40%, yeah, 40%, then she probably will continue to be able to do that. When
So
she's
she has other problems or stiffening, yeah.
Oh, yeah, yeah, sure.
Hmm. So I guess risk-wise for me, how long would I let her go before I'd have to do this for sure?
All depends on her symptoms, you know, so if she's about the same, then just keep an eye on her, but if you start to notice her huffing and puffing, just go out to the bath, come in,
Oh, yeah.
or if you notice her coming inside and she's starting to have that little wheeze, call me. Don't wait till she's,
Yeah,
you know, dropping from heat stroke,
yeah,
even if it's winter, you know, because they have to pant to thermoregulate.
yeah. Wow,
Okay? I'll photocopy this for you and you have it all on
Okay.
there, so.
okay. Are you
And,
gonna, like, email me a report, like a,
No, I'll send Dr., who is it, Perkins a report.
yeah, yeah,
Yeah,
okay.
okay.
Well, you're the best one to see for the situation, they told me that, that's why.
I'll let her know. And you know what, I can send you a copy of that report if you want.
Yeah, you could just email it to me, that would be great. They have my email, so.
Got it.
A copy of what you,
Yeah,
yeah.
my report to Dr. Perkins, I'll do that.
I appreciate it.
All right.
All right, thank you.
You're welcome. Let me see how she is.
She was screaming back there earlier.
Oh, she might be ready then.
Okay,
Okay.
thank you.
You're welcome.